Good day, sir. Today we will be discussing another topic about malpractices in psychology. What these malpractices are and what common effects of this on different patients are. So, malpractice performed by psychiatrists is different than that of medical doctors. Instead, these are typically negligence or an abuse of power. Negligence can occur during misdiagnosis or failure to document patient information, as well as failure to prescribe the proper psychiatric medication. Psychiatrists who take on too many patients may also find that they are unable to provide their patients with adequate reasonable care. Malpractice and suicidal patients. The law does require that a psychiatrist contact a third party when there is a risk that his or her patients may commit suicide or cause harm to themselves. If the psychiatrist fails to take action and prevent a patient's suicide and knew that the patient had intended to commit suicide, then he or she could be held liable under wrongful death action. Psychiatrists are also responsible for documenting all attempts at suicide, noting their patients' specific patterns and looking for indication that they may harm themselves. So, the effects of psychiatric malpractice can lead to emotional distress or physical injury. If a patient is prescribed a medication that is unnecessary for his or her condition, it could have adverse side effects or even lead to death. Also, a patient who requires medication to control his or her psychiatric condition but doesn't receive such medication could suffer from adverse harm or possibly death. Patients visit a psychiatrist because they have some sort of emotional trauma that they need assistance with. This is why psychiatric malpractice can be even more damaging. Patients can be a danger to others or suicidal from the trauma. Also, new psychological disorders could develop as a result of the malpractice, requiring longer treatment or resulting in long term disability. There are three primary ways that a psychiatrist can commit offenses against a practice. This exists in problems with medication, the the exploitation of the trust between a psychiatrist and the patient, and the third party liability issue. Some of this malpractice suits can occur when the professional believes that the patient is a threat to his or her own body or to others when this is not the case. Some psychiatrists also prescribe the wrong medication that can lead to complications with the body or mind, instances of violent outbursts, or the complete apathy of the patient. The psychiatric professional can commit offenses to his or her station by engaging in a lack of attention or too much attention to certain patients. This is possible when the professional does not see problems that happen because of medication, or when this individual places too much focus on other things, such as the relationship between the patient and parents. Sometimes the professional can engage in misconduct by not asking about consent for medication, or by using medication to attempt to cure the problem. Others commit errors with treatment options and what medicine to use to help assist with certain matters. Another way for a psychiatrist to engage malpractice is through having a sexual relationship with a patient. Normally, this is a consensual type of association, but because the psychiatrist is in a position of power over other person, there is no consent possible. The psychiatric professional commits misconduct when having a sexual relationship with any patient. This can lead to a lawsuit when the relationship becomes complicated or endangers the mental health of other party. In a documentary video on YouTube titled Psychiatry, an Industry of Death, there are footages and interviews of people or parents of abused children or malpractice in psychiatry. In the video, there was an American named Benjamin Rush said that insanity was caused by too much blood in the head. So he built a chair that looks like an electric chair, and the patient is confined there with sometimes cold water applied to his or her head for hours. Another physician is Henry Cotton, who mutilated his patients by removing their body parts. Cotton's mentors, Adolf Meyer, had come to the conclusion that infection didn't just cause diseases of the body, but of the mind as well. He postulated that mental illnesses was caused by focal infection, and that it could be cured by cutting away the source of the infection, something he called surgical bacteriology. For kids in psychiatry, a child is labeled that has DD or ADHD when he can sit still for 10 to 15 minutes period of times or talks constantly. Today, 20 million children are diagnosed with ADHD, and they made the children take pills, which was considered highly addictive substances, right along with cocaine and opium. Many conditions have overlapping symptoms, making it easy for some less experienced doctors to diagnose you incorrectly. As such, they may prescribe medications or recommend treatment options for a condition you didn't have. For many, receiving incorrect treatment can be dangerous. You may be allergic to a specific medication, and misdiagnosis can miss that vital information. You may also undergo surgical procedures that you don't need, leading to further injuries or health issues. In some situations, not receiving treatment may be worse than receiving the wrong treatment. For instance, if a doctor misses a cancer diagnosis, you may not receive the treatment you need. The terminal illnesses can worsen into the later stages. By the time the doctor catches your condition, it may be too late for treatment to work. It's vital to treat other conditions that are not terminal promptly. Failure to do so can cause deteriorating health issues. If the doctor fails to ever prescribe the correct treatment for your condition, long-term issues or fatal problems may arise. For some conditions, immediate treatment is necessary. Even a few hours between diagnosis and treatment can make a difference in someone's health, and any delay can be problematic, making it near impossible to recover correctly and return to your quality of life. Some of most dangerous conditions involving misdiagnosis includes heart attacks, cancers, strokes, and more. If doctors get these conditions wrong, you can suffer long-term damage, and sometimes the result can be fatal. That being said, malpractice is a wrongdoing because a doctor's diagnosis error leads to incorrect treatment, delayed treatment, or no treatment at all. A patient's condition can be made such worse, and they may even die. And that's for this topic. Thank you. Bye-bye.